Learning about the different states and stages of hypertensive management can be pretty overwhelming sometimes because there's a lot of factors that you have to consider outside of what the numerical values of your blood pressures are. Everything from primary and secondary hypertension to hypertensive crisis states, preeclampsia, and even permissive hypertension. It's a lot. It's a lot. No matter how you slice the pie, learning about hypertension states there's a lot of moving parts. Today on Make It Make Sense Cardiology, we are going to learn about one of those slices, and it's called hypertensive urgency. Student nurses, new graduate nurses, take a seat please, grab something to take some notes on, lock in, and let us learn. Now, hypertensive crisis is an umbrella term used to classify two hypertensive states: hypertensive urgency and hypertensive emergency. Today we're going to learn about this one, hypertensive urgency. Now, hypertensive urgency occurs in someone who's been diagnosed with hypertension previously in some facet, has been put on medications, and now there is an abrupt rise, significant rise in their blood pressure. Now, looking at this from a numerical perspective, a person in hypertensive urgency is going to have a blood pressure reading of systolic greater than or equal to 180, diastolic greater or equal to 120. Now, hypertensive urgency is not just about the elevated blood pressure readings. That's part of the picture. It's half of the picture. The other half of the picture is whether or not they are symptomatic. If your patient is asymptomatic, no headaches, no chest pain, no shortness of breath, no palpitations, like they don't feel anything that makes them feel outside of the course of what normal feels like to them, they just so happen to have astronomical blood pressure. This is hypertensive urgency. Means that we need to do something about getting that blood pressure down off the mountaintop, but it's not so far gone that we need to send them to the emergency room to get aggressive treatment. When you have a patient with hypertensive urgency, your first question to them, outside of how do you feel, your first question to them should be something regarding whether or not they've been compliant with their blood pressure medications, because that is the number one culprit of hypertensive urgency, non-compliance with medication. And I get it. There are some medications that just don't jive well, with us. They give us adverse effects. Totally understand. But patients, you have to do your part also, that if your blood pressure medicine is giving you some unwanted side effects, let us know. Let your provider team know so that we can make adjustments accordingly. Don't just stop taking your blood pressure medicine, because it can lead to very detrimental outcomes. So nurses, when you encounter these patients in the office setting, in the hospital setting, in the emergency room, in the urgent care, get a very good history on whether or not they have been compliant with medications. And if not, ask why. Was it because of adverse effects? Was it the medicine was too expensive? Was it not affordable? Did another provider recommend that they stop taking it? Like, what happened? Is it, too many times a day that the medication has been ordered? Like, some people are very good with taking medicines once a day, but when you start prescribing things that are 2 times a day, 3 times a day, life happens and we forget sometimes. Again, understandable, but the take-home point, nurses, get a very good and detailed history on why non-compliance happened. Secondly, especially if you were in the inpatient setting, especially in the emergency room, and maybe this happens in urgent care also. I'm not terribly familiar with that area because I've never worked in urgent care before, just in the hospital. Lab work is going to be done to see if there's been any impact of this very high blood pressure on any of the other organ systems. Now, here's another delineating point between hypertensive urgency and emergency. With urgency, you are not going to see any impact on any of the other organ systems. You just have a patient with exceptionally high blood pressure, again, 180 or greater on the top, 120 or greater on the bottom, no symptoms whatsoever, and no what we call target organ damage. No other organ system has been negatively impacted because of this blood pressure rise, a sharp rise in blood pressure. Get a great history from your patients. Get as much information as you can get for the provider team. When you pass the baton, nurses, the more help it's going to be for everybody involved. On subsequent episodes of this series on hypertension, I'm going to go over a lot of the other hypertensive states. I'm going to go into greater detail about emergency, hypertensive emergency, how to treat it, permissive hypertension, malignant hypertension. Oh my God, that's a big one. Now, I'm not going to delve too much into preeclampsia because the OB world, not me. Acute care, adult gerontology, nurse practitioner with cardiology certification. I don't dabble into the other worlds of OB and women's health. Stay tuned for subsequent episodes. This is just number one, y'all. Got a lot more coming. Have a great day.